Injury to the dog's claws. The injury or complete breakage of a claw is a relatively frequent reason for a visit to the veterinarian. In some cases, only a small part of the claw is damaged. In other cases, however, it disappears entirely with the vein. What causes dog claw injuries? The causes of injuries to the dog's claws are multiple. Claw breakage is usually due to excessive claw length. When the dog climbs on a rock, for example, one of its claws can be torn off, the hard support acting as a lever on a claw that is too long. Dogs can also get their claws caught in a treadmill, manhole cover, etc. Dogs can also lose one or more claws for no apparent reason. The fall of the claws can then be due to a tumor, an infection, or an autoimmune disease. What are the symptoms of a claw injury? When a dog breaks a claw, it usually starts to limp. The animal licks its paw and often shows signs of pain when it is placed on the ground or when the affected claw is touched. If you see a crack towards the tip of the claw, the dog reacts little or not to it, but when it is located towards the base of the claw, it can provoke stronger reactions. When the entire claw is pulled off, it causes both bleeding and pain. How to treat a dog's claw yourself. If only a small end of the claw is broken, it is generally sufficient to cut what is left of it, avoiding the vein. This is visible by transparency in the light. It may be useful to equip the dog with a special shoe for the first few days. How to treat a bleeding dog claw. To treat a bleeding dog claw, you must use an anti-bleeding product. A compress with hydrogen peroxide can also help disinfect the wound and stop the bleeding. Applying a bandage can also be a good idea to prevent the bleeding from resuming or your pet getting hurt. When to consult a veterinarian. Claw breaks are generally not medical emergencies, but a consultation can be very useful when the dog limps and is in pain. In the event of a major crack or bleeding, it is advisable to see a veterinarian within 24 hours. How to treat a dog claw. Depending on the severity of the injury, treatment may be surgical. Sedatives are administered or the dog is put under anesthesia before the procedure. In some cases, if the claw is not removed at its base, it can become infected and contaminate the bone. What care after the removal of a claw in the dog? If the claw is removed, the wound is usually protected with a bandage around the paw to protect the vein, 1 to several days. The dressing should be thin, protective, and changed once a day or more if it gets wet. When the bandage is re-bandaged, the vein must be carefully washed with lukewarm water or a saline solution. Sometimes it may be easier to shower the paw for a while to soften any scabs. If the toe swells or smells bad, contact your vet right away. During outings, the dressing should be protected with a plastic bag or a slipper for dogs. The dog bag or shoe must be removed when you are back inside your home. Once the bandage is removed, you can put socks on the paw and put a collar on your dog for protection. It is good if the vein takes air and can dry. Exposed and hardened, it becomes more resistant after about a week. It usually takes a few weeks before a new claw begins to grow. Sometimes the new claw is deformed, and if the bone has been badly damaged, the claw may not grow back. Calm walks on a leash are recommended for the first week as the vein is very sensitive to the touch. The collar is indicated as long as the dog tries to lick itself at the level of the wound. How to cut a dog's claws without hurting it. To cut a dog's claws without hurting it, locate the part to be cut. If your dog has white claws, the portion to be cut and the portion that is not pink, the pinkish tint betraying the presence of blood vessels which should not be touched, under penalty of injury and bleeding. If they are black, use a lamp to distinguish the innervated part from the portion to be cut with nail clippers. If your dog is recalcitrant or you are afraid of hurting him, use a file.